Hello, and a very warm welcome to COVID-19 Updates from Singapore. My name is Caitlin Wee, and I'm a third-year medical student at NUS Yong Lu Lin School of Medicine. This is a series of webinars presented by NUS Yong Lu Lin School of Medicine, National University Health System, and Global Outbreak Alert and Response Network. The COVID-19 Updates from Singapore weekly webinar series will provide viewpoints and insights from a panel of leading experts in infectious diseases and related specialties and disciplines. It is now my honor to introduce you to our moderator, who is also the program director of this series. Recruited to establish an infectious disease training program in Singapore, he was the first infectious diseases head of department in the Communicable Disease Center here in 1992. He is currently Associate Vice President for Health Innovation and Transformation, National University of Singapore. Ladies and gentlemen, Associate Professor David Allen.
Thank you, Caitlin. Good evening and welcome to the 22nd installment of our webinar, COVID-19 Updates from Singapore. We hope you're becoming more comfortable in our new world and your place in it. We thank you for including our webinar in your weekly schedule. We feel responsible to assure your time is well spent with us. As a reminder, including tonight's episode, there are only 3 episodes left. Be sure to register for the final 2 episodes if you've not already done so. The topic for tonight's discussion will be strategies to mitigate the rippling impact of COVID-19 from host virus interaction to geopolitics. Our guest expert this week to help us explore that subject is Sir Jeremy Farrar, whom I'll formally introduce after Dale's epidemiology update. We continue with our customary format this week. There's a weekly epidemiology update by Dale, the opening comments by Sir Jeremy, followed by discussion with him and myself, a review of current events by Dale, and then a preview of next week's guest expert and the reveal of the mystery pandemic song of the week. Please send in your questions and the country from which you're watching this episode via the Q&A tool at the bottom of your Zoom screen. It's now my pleasure to introduce Dale Fisher, Professor of Medicine, National University of Singapore, Yong Lu Lin School of Medicine, Senior Consultant, Division of Infectious Diseases, National University Hospital, and Chair of the Global Outbreak, Alert, and Response Network, hosted by the World Health Organization. Dale, over to you.
Thanks, David, as always. Okay?
Yep.
Great. Well, we'll have a similar format to the last 22 weeks, did you say, David? So I'm comparing the Johns Hopkins University websites again. You can see over the last week from the 27th of August to the 3rd of September, there's been about 1.9 million diagnoses made and just under 40,000 deaths reported. So this is pretty consistent, and that's shown up in the global epi curve here, which I'd have to say is really just really consolidating what we've been seeing over the last month or two. In India now, the receiving the most cases, hosting the most cases every day, every week, followed by Brazil, and USA's numbers are coming down. As I go to the different regions, WHO regions, again, you can see the PAHO, the Pan American health area, is the cases are possibly coming down, deaths probably not yet. Southeast Asian region is continuing on this relentless number of cases, but maybe the deaths are flattening out relative to those. Europe's got this remarkable trend of increasing cases in the wake of their summer holiday, but managing to control the death numbers well. So I think we know that there's more younger people getting diagnosed, and clearly people are figuring out how to protect the vulnerable. Eastern Mediterranean, the numbers probably trending down. Africa, we may have to believe it. We always wondered how the African region would pan out, but in terms of having a younger population and a more resilient population, but nonetheless, there's a lot of deaths there compared to the number of cases, so ascertainment remains a problem. And in the Wipro region where we are, I think we're seeing some stabilisation and improvement over here. Let me just take those each in turn now. Again, you can see Brazil, US, Argentina, Colombia are seeing the most cases and the most deaths. Just to look at those, you can look at the shape of the curves of every country and how that really reflects on the total regional epi curve. Pretty flat here, but as I've said in the past, just look at the number of cases per million and the number of deaths per million, and we'll compare that shortly to the other regions, which are clearly significantly less. I just wanted to feature Colombia and the US this week. I don't think we've done Colombia before, but for those who don't know, it's up in the north of South America, just connecting to Central America. It's got a lot of slums like other parts of South America. Population of about 50 million, 633,000 cases and 20,000 deaths. If you look at their epi curve, they've had about 5 months of these emergency measures in place, but because they're starting to see their cases come down and hospital numbers have stabilised, and as have the deaths, they're keen, like everyone, to open up their economies. Their unemployment rate's doubled. It's about 20% since the outbreak started, and their economy has shrunk almost 20% in the second quarter. So they've opened up airports, bus terminals, restaurants, gyms. Bans on internal travel have been lifted, but there's still going to be restrictions on events and large crowds. So let's hope this downward trend in Colombia continues. Just comparing the United States, as we mentioned, the numbers of cases seem to be coming down, deaths probably flat. And the states still most affected are New York with 33,000 deaths, although their incidence is not so high now, but they recorded 468,000 cases during that time. New Jersey comes second in the deaths at 16,000 and almost 200,000 cases, and California, which is one of the hotspots, is 721,000 and 13,000 deaths. So New York clearly did it in terms of deaths, at least what's been counted to date. Just wanted to highlight, this is quite sad actually. Look, no antibiotics ever. Free range, vegetarian fed. This is a chicken farm called Foster Farms in California, and they've had a fairly large outbreak. There hasn't been an outbreak, at least I haven't heard of one recently. It was obviously food processing plants were a big feature, but I think we're starting to get better at those. But this outbreak actually started at the end of June. They've had this is in California, a place called Livingston. They've had 358 cases, including 8 deaths in their workers. So it obviously wasn't well done. They said they were doing mass screening and they tested 100 people and there was 25% positivity. Anyway, this is closed down now, but keeps raising this issue of transport of COVID across borders on frozen food, which, as I've said before, I'm a bit of a fan of the theory, at least the potential. Huh. The other thing that's come from the US is Dwayne Johnson and his wife and 2 daughters have had COVID since we last spoke, and well, he had it for 2 or 3 weeks, but he's recently spoken out about it. And I just wanted he gives a lovely video, and again, I've spoken before about using influencers in society to send the message, and I think people get sick of hearing the politicians and the experts talk about it. So he gives quite a nice little video. Moving on to Southeast Asia, again, the major countries: India, Indonesia, Bangladesh, Nepal. Some of these really going the wrong way. Myanmar's had a bit of a spike. Myanmar actually has you can see there its case numbers have jumped, and a lot of these are in places outside of the capital, Naypyidaw. So a place called Rahine and Yangon are more hotspots. So actually people going into the capital now have to quarantine and have swabs, and I can't say I've ever really seen that work. But anyway, that's a little bit on Myanmar. And look at Thailand here. You can see they had a big hump and then not much. So this is what Thailand looks like. I have to say this is one of those countries that's done the aggressive lockdown, the tight border closures, and all these cases along here are imported cases. And as I've said before, I think you tend to paint yourself into a corner when you're relying on border closures, because it's very hard to see how you open those and the endpoint. You can see the borders here, and they're trying to promote local tourism. And I must say, I felt a bit of a heart flutter when I saw these beaches and the speedboats. I think many of us have been on nice places in Thailand with these sort of tourism. Okay, the European region. The main thing to point out here is the country is still quite significant numbers of cases every day. France has even gone higher than this recently, and you can see the shape of their curves, which reflects on the main curve, and you can see what's happened. Spain, France, Ukraine, Israel's flattened out. But again, you see the new deaths per million population is all single digits. It's really something different going on there in terms of protecting the vulnerable, obviously. So Europe, of course, went back to school. I'm reminded last week I presented our masks in children effort in the WHO. So you can see some of these kids haven't been in school for over 6 months. They've been doing virtual learning. So here, whether you're social distancing when you're younger or wearing masks when you're older, and obviously all the other things, there's various quarantining if you're from the wrong part of the country, I guess, and there's staggered breaks. They have class bubbles, lots of rules, but let's see how the school openings pan out. We all know this is a sort of a hidden problem that's happening or maybe it's not so hidden, but the ramifications of long-term missing school is not to be underestimated. Eastern Mediterranean region, again, apparently coming down, but Iraq, Iran, all these countries have had a lot of trouble getting community buy-in to a lot of their work. And again, you can see largely single-digit deaths per million population. So if these numbers can be believed, I guess they're going in the right direction. But we've heard in the past that reporting in a lot of these countries is also challenging for a number of reasons. The African region, I don't understand. I'm going to have to call Chikwe or something, I think, and find out if this is true. What is the degree of under ascertainment? But the African epicurve, I think, is a bit of a surprise to many of us. And again, just few deaths being reported per million population. Just wanted to give a call out. Uganda's got some problems. You can see it's quite a messy epicurve. Obviously, expressing the challenge they've got in testing and reporting. This is one of the largest, I think, the largest refugee camp just over the border from DRC. This they've had to lock down because they've had 22 humanitarian staff and 72 refugees tested positive. So there's 123,000 people in this, and even there's people that have lived here. I saw one person had lived there for 11 years. The food's being rationed because the pipelines are not there anymore. So these are really dire places at the best of times, let alone in COVID times. So that brings us to Wipro. Most of the cases coming from Philippines, Japan, Korea, and you can see the Philippines is flattening out. Japan's coming down. Korea possibly flattening. I'll come to that in a minute. New Zealand is still rumbling along in its cases, often single digits a day, but I don't think I've seen a 0 day. So their dreams of eradication are smashed, at least temporarily. We'll see if they want to go back to an eradication strategy or learn to live with the virus, which we would agree with. Okay, compulsory mask wearing in Auckland, although the lockdown's lifted. Sorry, compulsory mask wearing on public transport in Auckland. So these are some epicurves. I won't spend too long on them because I want to get to Jeremy, but you can see Hong Kong's continued on its way down. They're doing a mass testing exercise, which is they're trying to get 5 million people tested over the next week. It's voluntary, but there's lots of conspiracy theories going around about storing DNA and things like this. But the other thing is that they're opening up gyms, but you have to wear masks. They're opening up restaurants for an extra hour. It used to be 9 p.m. Now it's 10 p.m. Massage parlors are opening up. So Hong Kong is returning to a COVID normal. Japan's also making its way down. Philippines, they've got an interesting thing going on there with a lot of bartering, and it's often bartering for food. So people are trading in maybe unwanted clothes or baby bottles now that their baby's not a baby anymore. And there's a lot of bartering. I think about 100 Facebook groups with a very large number of people where that's become a new currency to get food. So some interesting changes in the Philippines. And South Korea with 20,000 cases and 329 deaths. About 40% of their active cases are over 60. So things are changing. During this wave, obviously, there were a lot of young, particularly young females who were in those 2 church outbreaks particularly. But this has got a lot more older people, and they're now looking at their ICU beds as a problem. They've got 511 ICU beds in the country. In the first wave, they only had 12 people need ICU beds. Now they've got over 150 people in their ICUs. So most of their beds are still taken up by non-COVID patients. But this is a challenge for South Korea. I must say it's pleasing. They've done some very targeted strategic shutdowns, the usual favorites, the restaurants, the coffee shops. There was outbreaks in Starbucks. They've got these things called hagwon, these cram schools they're called, and about 3 out of 4 children go to these. It's the Singapore equivalent of tuition, but anyway, so they've had to close those. A lot more working from home, especially in the big industries, Samsung and LG, things like that. Okay, let's bring it to Singapore. Much the same, the imported cases here, community cases still single digits repeatedly, dorm residents coming right down. A lot of these are picked up on asymptomatic cases, and it's a bit unsure whether they're old cases with residual PCRs or whether they are some of the COVID naive people getting positive. But still, there's good signs in the dormitories after a very long time. I just wanted to point out, these are the people that Singapore, despite those small numbers, these are the number of quarantine orders given out by Singapore every day. Forget this one, that's only the morning. But it's really remarkable. And I contacted my colleague at MOH, Vernon Lee. So I want to give a shout out to all the contact tracers. Contact tracing is not easy. You've got to be trained, you've got to be empathetic, you've got to have patience, because people are sharing people that might have to go into quarantine. So at the peak, there were about 800 contact tracers. Now it's about 300 plus. And these are guys and girls from the Communicable Diseases Division, from MINDEF, from SAF, from police and other places. So thanks, guys. You're doing a great job, and the heroes behind the scenes. So where are we in Singapore? Haven't had an ICU case since I don't know when. Haven't had a death for a very long time. We've got 75 in hospital. We've got a problem, an existential crisis for our community care facilities, because they're hardly needed anymore, with just 800 people. David, it's been my pleasure. Over to Jeremy and you.
All right, thanks, Dale. Just to reiterate the notion of, or not the notion, the issue with animal protein trends being a source, a vector for the virus. Obviously, washing hands and cooking the protein properly would resolve that issue.
I prefer to put the efforts at the source. Keep those food processing places clean.
Great. Thanks, Dale. Remember to send in your questions and the country from which you're watching via the Q&A tool at the bottom of your Zoom screen. It's now my privilege to introduce Jeremy Farrar. He's director of the Wellcome Trust since 2013, former director of the Oxford University Clinical Research Unit in Vietnam for 18 years. He's a fellow of the National Academies of Science in the USA, the Academy of Medical Sciences in the UK, and a fellow of the Royal Society. And for good measure, he was knighted by the Queen in the 2019 New Year's honors for services to global health. Born in Singapore and continued friend of Singapore. The theme of his opening comments in our discussion will be strategies to mitigate the rippling impact of COVID-19, from host virus interaction to geopolitics. Welcome, Jeremy.
Yeah, good morning, good evening, or whatever time of day it is. And David, it's a pleasure to see you. And it's always very good to either meet up or follow Dale. So that was an amazing overview for everybody, and pay tribute to everybody that's put this series together. Pleasure to join. It's very easy when we've been, many of us thinking about COVID for what, almost exactly 9 months now, to sort of get used to some of those figures that Dale just ran through. And across everybody on this call, I'm sure, and across society, I think it is really important just that we remind ourselves just how staggering those figures truly are. The US, if I just pick out the United States for a moment, is likely to get to 200,000 deaths some point in September due to COVID. I'm not sure even though I've worked in emerging infectious diseases for many years, ever thought we would be in a situation like that, and we mustn't stop on all of the work we're doing, because this won't go away on its own. In my belief, it is a human endemic infection now, which will continue to reverberate around the world. And unless we keep up the efforts on public health, on building trust in societies, and of course on the critical research and development side, so that we can get interventions that make a difference and make those accessible around the world, then we won't see the end of this and get back to anything like normal. And that's what I'd like to spend 6 or 7 minutes talking about now. As Dale said, there's about 25 million confirmed cases and about 900,000 deaths now. And this is just a personal guess based on knowledge of serological studies from around the world. My best guess actually is that there are closer to 200 million total cases around the world. And probably something like 1.5 million deaths have occurred over the last 8 or 9 months. Dale has presented wonderfully the epidemic curves from everywhere, and I think in many parts of the world, numbers have decreased recently, with some, of course, really important exceptions. The only caution I would have there is I think what we are seeing, particularly in North America, indeed Central and South America, and certainly in Europe, has been a shift in 2 ways. A shift from major urban centres, London, New York, Paris, etc., over the course of the last 3 or 4 months, into more rural communities. And rural communities in many parts of the world tend to be older and tend to have less good access to healthcare. So although we may see overall numbers decreasing, I would caution that we still will have continued problems in transmission within communities, which will shift from urban centres into more rural centres. Just picking up a little bit on the area that actually I know best at the moment, which is Europe, and I think Dale's comments are very well taken there. There's no doubt that particularly in France and Spain, we're seeing an increase in transmission, and indeed in Germany and the Netherlands and other countries. That transmission is increasing, particularly amongst younger populations. Through the summer months of June, July and August, the overall transmission did decrease. But we are seeing an increase through August and now coming into September. In France, perhaps the best example, but it's not only France, where the R is increasing, transmission increasing, but it is happening in a younger population. And I think the things to watch in Europe over the coming days and weeks really is whether that transmission in younger people comes across into more vulnerable populations, as it did in February and March when the world was in a very different place. But it's making sure that we don't allow that community transmission to come into those more vulnerable populations. If we can avoid that, then I think we can avoid the horrific scenes that we did see in March and April in much of Europe. But it is happening in the Northern Hemisphere at a time when we go from summer into the autumn and then into the winter. It's a time, as Dale said, when schools and universities, further education and workplaces are starting to go back to work, and we can anticipate that they will add to the potential for transmission. So I think we're at a turning point in Europe with regard to COVID-19, and the actions that we take in the coming days and weeks will be critical in determining whether we go into a very, very bumpy and more severe winter season in the Northern Hemisphere, or whether we're able to mitigate that by preventing the spillover into more marginalized, more vulnerable populations. So in the 9 months that we've had since this first started, I first heard about it, I think, on the 31st of December or the 1st of January at the turn of the year from good colleagues and friends at the Center for Disease Control in China. We've undoubtedly learned a huge amount. Some of those lessons in some countries, Singapore I would pick out, but there are other countries as well that have done extraordinarily well. Germany, New Zealand, Vietnam, many countries, Korea, have done extremely well. And that's because of a huge amount of hard work and also making good decisions, because you can learn lessons, but the crucial element is to apply those lessons and be willing to remain humble and have a degree of humility that you can best learn from other people often and their experiences for. And that actually probably no country is exceptional, and that every country will have to face something. So public health knowledge has improved. Understanding of pathogenesis has obviously made huge stride, and that's led on to improved treatments. In many parts of the world now, your chance of dying if you have got severe disease and are admitted to hospital is significantly lower than it was even 3 to 6 months ago, because doctors and nurses are much better at treating patients, preventing that progression to more severe disease and the need for ventilation. Other areas, genetic sequencing has been shared. The scientific community, I think, has stepped up and worked in a different way to usual. Diagnostics have been improved, and obviously understanding of immunology, and particularly understanding immunity and whether you are protected after infection and whether you have a chance of getting reinfected, and if so, with severe disease, is also improving. Vaccine development has been staggering, and I think we will see the first data on new vaccines coming in October and November. And then we are working very hard. Dale's been very involved in this with WHO, the ACT Accelerator, and the COVAX initiative, which the Singapore Prime Minister highlighted as being a lead to vaccine multilateralism and avoiding vaccine nationalism, I think is going to be a critical component in making sure that the vaccines and treatments that do become available in the coming weeks and months are made accessible to the world in an equitable way, and not only available to those that can afford it. At the heart of all of this is trust. And one of the things it might be interesting to pick up on when we come to the discussion is science has been absolutely front page of all newspapers, all discussions, all media interest over the course of the last 9 months. That puts science into a difficult position. Science needs to have humility. It needs to be clear what it can do and what it can't do. And I don't think we will go back in the whatever post-COVID era means, where science will be back into, if you like, the ivory towers and almost in secret. Science is now out there, and we need to be aware that science is also part of a trusting society, and we need to make sure that we don't oversell science, that we respect science's independence, that the institutions looking after science within communities is kept independent of political overlays. Institutions such as the FDA or the regulatory authorities in Europe, in Singapore, Japan, and other countries. These need to be independent to be able to assess that science and make sure that the society has trust in that independence and it does not become politicized. Just briefly now to just talk about what I regard as the consequences of COVID and the consequences for the future years and potentially decades. I personally believe we're still underestimating the impact this will have on societies over the course of the early parts of the 21st century. And the way I frame it is around 4 overlapping circles, which are all interrelated, but which just break out into 4 groups. The first one is the direct effect of COVID, the direct health consequences, the severe disease, and tragically the deaths, the people it affects, and indeed the health inequalities that drive from it. The second is the indirect health consequences. In almost every country, other issues such as childhood vaccinations, maternal child care, cancer therapy, care for people with diabetes, many of these have had to take a back seat as health services have been overstretched in dealing with COVID. Those issues of cancer, diabetes, hypertension, mental health have not gone away, and yet they've not been at the forefront of health services, and those issues will continue to be problematic. The third area, the third ripple effect, is on economics, on financing, on jobs, on security, on inequalities in society. We've seen tensions in many countries where COVID has had an unequal impact on elements of society, on trade, and indeed on politics. And I think COVID will have an impact on the political scene globally. I suspect there will be changes in elections. Politicians will rise or fall depending on how they're perceived or have responded to COVID, and how they have been seen to be there when the citizens of their country needed them. And I think the ramifications politically in 2020 and into 2021, we will still reverberate, even if COVID starts to hopefully reduce in its impact. And the fourth one is geopolitics. We're facing a very tense world at the moment, tensions between East and West, tensions indeed between North and South. And I think the way we address COVID and the way we approach it from an equitable access and a global multilateralism approach is going to critically define how we come out of COVID and how we address essentially both COVID and future epidemics, but also some of the great challenges of the 21st century, climate change, drug resistance. These are not issues which can be dealt with by any one nation on its own. And how we deal with COVID, how we pool our resources, how we make sure whatever we do is made available to the maximum number of people globally in an equitable way, and how we pool the science and the policies that come from this, I think will help define how we work through these other great challenges, which are by their very nature multilateral rather than able to be dealt with in a nationalistic way. And there's no doubt that COVID does represent something we will see far more of. Epidemics in the 21st century are going to be more frequent. They're going to be more complex. As ecology change, environment changes, as the human-animal interface changes, whether by farming, informal or formal. And of course, we now live in much bigger cities, which are much better connected, both nationally and internationally. So we can anticipate that epidemics, as we've seen actually over the last 20 years, will become more frequent and more complex. In addition, as I've mentioned, climate change, drug resistance, and many other major challenges are not things that will remain national in their impact or in their response. Plus, the impact on supply chains, on trade, and on global economies are going to be crucial. And I think we will have to revisit this balance between efficiency, next day delivery, everything available as you want it, with supply chains that stretch in complex ways all around the world, to more resilience built into the system. Resilience is absolutely crucial in public health. You cannot just turn public health or indeed clinical services on when you need them. You have to invest in them over time. You don't see necessarily their benefits for many years, but it's very clear to me that countries with the strongest public health systems, the strongest trust between politicians and their societies, and the ability to respond based on years of investment in public health, in the end will come out of this COVID stronger than they went into it. And it's a lesson that if you don't invest in those essential services, which are essentially public, then you won't be able to respond when you need to, and you cannot just turn that on overnight. And the other element of that, of course, as I've mentioned, is absolute investment in institutions which are above politics and cannot be influenced by politics. So I do think we need to come together. Singapore has played a very important role in that. The COVAX initiative through WHO to provide access to vaccines, and a similar one through the Therapeutics Accelerator for therapeutics, and indeed PPE, health systems, and oxygen supplies around the world. These are absolutely essential through the ACT Accelerator, which WHO convenes and which many of us are a part of. And that is going to be the route out of this in a way that both the rich and poor world can contribute to and ultimately benefit from. And it'll be that that defines how we come out of COVID-19 and how we address these great challenges of the coming decades. David, I hope that wasn't too long. Back to you.
No, that was great, Jeremy. Thank you so much. And you've raised some wonderful points, obviously. There's a lot of things that intersect that you raised. There's some short-term political opportunism, whether it's geopolitical or nationally, to undermine some institutions, which raises concerns about governments, about trust in politics, trust in economies, trust in science, in medicine even. We're pulled into that. How do we counter that? How do we counter detail those efforts? Because people are looking to stay in power.
Yeah, it's very complex, and you know, frankly, science and scientists, and I'm, you know, David, you've been in this position, and Dale has as well. Many on the call will have been. You know, science doesn't naturally fit into that space. You know, scientists like to keep to their area of expertise. They generally think everybody in the world is nice. They don't tend to like to get involved in politics. I think it's a mistake. I don't think science can exist in a vacuum outside a society, and B, appreciate that science, public health as well, is part of the society in which it's in, and that is inherently political. And if we don't make the case of science with humility, don't overstate what science can do, and be honest and transparent about science, and make the case that these institutions have to be independent and trusted and invested in, then I think we're not contributing to society enough. So I would encourage everybody to not just see science as something that happens in an ivory tower or in a vacuum, but is part of society and must engage with it, and has to engage in the political process.
So that brings us to an important question. What is your mission at Wellcome Trust? What is your job? How is it relevant to COVID-19?
I wish I could define my job. Life would be much easier. My day job at Wellcome, which I left Southeast Asia and Vietnam and Singapore for 7 years ago. Gosh, it sometimes feels a lot longer than that. I mean, Wellcome is the world's second largest philanthropic organization. We are set up by an American. We happen to be in London by an accident of history, which I constantly remind UK politicians about. And it is there to improve health through research. We're committed to science, we're committed to innovation, and we're committed to putting those two in the context of the societies it operate on. I've wanted Wellcome over the last 7 years to be more global. I've wanted it to appreciate the important voice philanthropy plays in taking risk and backing people and making an impact on the world.
Dale, you have a question for Jeremy?
I wanted to take you up on that other one. We have been saying that politicians should be better at science, but you're sort of touching on scientists should be better at politics. And so I want to give a question that's been asked by Taran Wiramanthri, an old buddy from Darwin. He said, talking about institutional trust, can you comment on the abolition of, it's probably not quite true, but the abolition of Public Health England and the creation of the new protection agency. But I wonder if we could move that on to CDC as well, who have probably suffered a similar fate in the US.
Yeah, Dale, I think the way you frame it is I think, spot on. I think we have bemoaned that politics and politicians have not appreciated sufficiently science. Frankly, not enough scientists have gone into politics. Politics in many parts of the world tend to be dominated from the humanities, which obviously crucially important, but scientists have to get involved. But I think the way you frame it, that it's not just scientists who have to get science, politicians who have to get science better. Scientists have to appreciate that these are political in their nature in some way, shape or form. And national institutions, yes, whether you call it Public Health England or Centre for Disease Control in the US, or indeed in China or Russia or Singapore, they have to be trusted by society in a way almost above politics, because politics, rightly or wrongly, is under a sense of mistrust at the moment. And I think it's crucial these national and indeed global institutions, WHO, crucial player in the world, are supported and being seen by society as above the day-to-day politics and trusted. And I think we must not lose that. We have to retain our independence, and we have to be willing to speak out when bad things or wrong things, as we perceive them, are happening.
Just transitioning a little bit from there, you've been involved in a global preparedness report WHO puts out through the Global Preparedness Monitoring Board. It looks at weaknesses and remedies as far as our global situation with regard to coming pandemics. I guess it was started in response to SARS and avian influenza and Ebola, et cetera. Could COVID-19 be the impetus for the world to finally make the massive investment that's needed? And if so, how much money are we talking about?
It has to be. I mean, there'll be people on this call, you have, David, Dale has, I have. I mean, just go back 20 years and, Southeast Asia, when I started getting involved in this with the Nipah outbreaks that you will remember very, very well in Singapore and Malaysia, of course, and now Bangladesh. But just plot that forward for 20 years. SARS-1, SARS-2, Ebola, Zika, MERS in the Middle East, of course, the pandemic of 2009. We've had warning signs. We've had repeated warning signs, not annually, but almost annually, of epidemics becoming, yes, more frequent, but also more complex. Look at Ebola in West Africa in 2014, gone from being, a rural disease which you could isolate and quarantine and deal with, to a massive problem across 3 countries, disrupting whole societies. So this is the nature of what we will face now because of those ecological changes and the way societies operate. They won't be national, they'll be regional or pandemic in their nature. And unless COVID-19 is the stimulus for us to invest both nationally in public health structures and globally in organizations such as WHO, then we will not be able to face the inevitable future epidemics that come. Yeah, it is a large amount of money, but to date, I think the world global economy has lost somewhere between 12 and 15 trillion US dollars. That'll take a long time to recover. Some economies will be put back by a decade. Debts are rising in many middle and low income countries. Remittances are reducing and job losses may never come back. So the economic impact of, let alone the societal impact of what we face now is truly astronomical. And yet a small fragment of that invested in public health, I believe, could have prevented what we are going through now and will be essential going forward.
Let me combine a few things, and they're not necessarily related, but I'm going to try to relate them a little bit. Wellcome Trust has been behind some moves to change the culture of academic medicine, to try to move away from the publish or perish. And Wellcome is very much involved in trying to get academic publications to be open, in open forum, so they're accessible to everyone, and not a financial burden or inaccessible because you haven't paid a prescription or subscription, excuse me. And finally, along this line, there are lots of articles that have been published with useful information that have been spoken of and policy decisions made of them that are pre-published and not peer-reviewed. Would you share your thoughts about those disparate items?
Yeah, I don't think they are disparate, David. I mean, you blended them in a way, in a magical way together, but I think they are associated. They actually also associate, in my belief, with the sense of trust that we have to engender within the societies that we operate in. So where to start? Firstly, I think that science is part of the societies we're in. Much of it is based on public funding or philanthropic funding. And therefore, I think the public has an absolute right to have access to it, let alone scientists in high, middle and low income countries in a scientifically equitable way. But I think hiding these things behind paywalls, not accessible, is no longer appropriate. And I think COVID will, along with many things in society, will change the way we think about publications. Yeah, there undoubtedly have been negative consequences about just putting things out there in preprint materials and prior to peer review. On the whole, I think the net positive massively outweighs the negative. I think things are corrected pretty quickly. And the fact that this wealth of information has been put out there, mostly freely available to read by everybody in the world, I think has moved on the scientific knowledge base, and therefore better policy decisions where that's possible have been made as a result of it. So yeah, I remain an absolute fan of open access to scientific literature, and I think this will shift it in a very fast, rapid way forward. Technology will also help that. On your comment about the scientific endeavor, this I think is really a great future discussion as well. But very quickly, my view is that the scientific funding landscape has shifted scientific work into two short-term endeavors. I think many people, particularly in their early and mid-careers, are now focused on what can I ask that will get me an answer in 2 to 4 years that can get me the next grant or the next promotion in my university. And I think we need to step back a little bit and ask, what are the fundamental questions in science we need to address? And they will take longer. And I think funding agencies, including governments, and I've spoken to Singapore government funding agencies about this regularly, I think we need to liberate the scientific endeavor to ask those big questions again. Because too much money in the scientific endeavor globally now is via short-term money, soft money, short-term grants. And I think we're corralling science into frankly, a very short-term endeavor. I would like to see that liberated, longer-term grants, and frankly, a much better research culture and a much better career ladder to entice the very brightest young people to come into this endeavor and stay in it. Because at the moment, I don't think we're providing that sort of career structure for the next generation of Davids and Dales.
Yep, thank you so much. Joe, could you put up the slide with the car? This was a tweet, I think possibly from today. Tell me what your thoughts are about this. What were you thinking?
Twitter is, I'm sure my lawyer would tell me to stop using but so this is it's a big debate which has been raging. I'd be very interested in both your and Dale's views on this. In terms of testing, which we all know is crucially important to controlling the epidemic, do we have to have the sort of perfect test done in a complex way, complex sampling, has to go to a laboratory somewhere, results come back in a certain time frame, gold standard, even though actually we know even the PCR test is not a gold standard? Or would we be better to accept a slightly lower sensitivity and specificity, but a much more accessible test that could be available in people's homes, rolled out, and you would push up the testing within a community massively, whilst accepting, yes, a slightly lower sensitivity and specificity? My belief is that that technology hasn't existed until recently, but it is starting to come in now. And actually, I'm more in favor of making tests much more available in people's homes, able to respond immediately, and reaching a much bigger part of the population than we've currently been able to do with the current approach using a laboratory test.
I think you're right. I think the world is moving in that direction, and people who are traveling and being swabbed frequently, or in other circumstances requiring to be swabbed frequently, would beg not to be swabbed quite so frequently. Yeah, I think you're absolutely right. United Kingdom case fatality rates greater than 12%. Why is it so much worse than others?
I think there's a lot of reasons behind this, and UK was slow to respond. I think we were slow, particularly in January, February, and early March. We did not have the right infrastructure in place to see what was coming, and it's a big lesson now as we go into September, when we can see cases increasing in continental Europe, and critical to learn the lessons there. The NHS is a wonderful institution, but it is very stretched. The relationship between hospital care, primary care, but critically care homes was not well dealt with. And as everybody knows, a number of people were moved from hospitals into care homes without adequate testing. And the care home sector has to be looked at in all of this in terms of the facilities they run. Off the top of my head, I think 25 or almost 30,000 people that died in the UK were from care homes. I mean, that is a staggering statistic, which we must never allow to be repeated again. And we do have to learn the lessons of this and look at this relationship between primary care, hospitals, and critically our care sector, because we expose a lot of very vulnerable people to this severe infection in that community.
Are you satisfied with the amount of test, trace, and isolate quarantine currently being utilized in the UK?
No, I'm not. We're going to go into a bumpy period now, September, October, November, the winter months when schools reopen. We know that when you open schools in the context of them having been closed, not like Singapore, but if you have closed schools and you then reopen them, you're likely to push the R value up by about 0.3 or 0.4. It's already above 1, probably in parts of the UK. And so I think we're going to have a bumpy September, October, November going into the winter, and testing and test, trace, isolate, and infection control, and some degree of quarantine, self-imposed or imposed upon you, is going to be critical in terms of breaking the chains of transmission. Look what you've done in Singapore. I mean, the figures speak for themselves. You've had a very strong public health response. You've had, I think, trust from the community that you're doing a good job. And you've had widespread testing and actions taken as a result of that. There are lessons to be learned in many other countries from the way Singapore and Germany and Korea and Japan and other countries have responded, Vietnam as well.
You spoke of the almost annual pandemics, whether it's Nipah or MERS or SARS or COVID-19. And many of these they all have interaction with animals in our environment. Do you see parallel efforts that we should learn, or parallel information that we should learn from our experience with COVID as far as climate change, how we grow? We're 7.6 billion people now, of which you speculate 200 million have been infected. But what are your thoughts about climate change and COVID-19 and epidemics and pandemics?
I think these are, for me, they're very much linked. Inevitably, the climate change and the ecological environmental change that comes from it has an impact on the animal-human interface, and also are by their very nature multilateral rather than unilateral. So I think many of the sort of core issues that come up in COVID, ecological change, urbanization, connectivity, are going to be relevant in all of these issues, nationalism versus multilateral approaches. And I think there are huge lessons. All of the great challenges of the 21st century that we're going to face are going to have these as their core features. And if we do revert, or we continue down a track of narrow nationalism, of thinking that I will be okay and I don't need to worry what happens to others, then I think the impacts that we see in the 21st century from pandemics, from climate change, from drug-resistant infections, will just amplify, as we've seen in COVID. So if we don't learn the lesson now, after watching Nipah and MERS and SARS-1 and SARS-2 and Ebola and the climate change impact, if we don't learn these lessons and realize that the world needs to come together, then I think we will really have a very difficult 21st century. And, you know, I'm not a historian, but you can either look at what happened after 1918 and the end of the First World War, when we went to a very nationalistic agenda, or in 1945, when the world came together and said, never again, we're going to build these institutions, the United Nations, WHO, the World Bank, the IMF. They all need reform, but we need them now more than ever.
Jeremy, thank you so much. We're at the end of our time together, and I'm sad to hear that, but sad to say it. But we're going to jump over to Dale, who's going to give us some updates. Dale?
That was inspirational as always, Jeremy. And let me just say, it's also a beautiful segue to what I was going to talk about tonight. Apologies to the audience. I think we should just, going forward, call this a show that starts at 7 and finishes at 8:10. I wanted to take on this Herculean charge approach to national unity and global solidarity. We keep hearing about it, and I just want to give you a few examples that might help crystallize it, but it's very much in line with what Jeremy was just saying. And then just a couple of brief ones on a Lancet article and on messaging. So national unity, this should be the one that's easy, right? It really makes no sense to fracture people within a country. You clearly need to work together on the public health efforts. COVID has linked the economy with geopolitics and social values within countries. Case in point is really Australia, which obviously is my original home, and it's really quite sad to see that these borders, which are really political borders, have actually become real borders now, where people can't cross from one place to another. There's debate over whether there should be eradication versus suppression, and New South Wales, Victoria are saying suppression, eradication's too hard, and I would say, why are we eradicating anyway? It's not going away. You can't keep your borders closed forever. So this is a huge problem, and obviously has a huge social impact when people can't get their families on the other side of the border, especially these border towns. They can't even fly between cities, at least not without quarantine for 2 weeks. The health effects, some people, their doctor or their hospital might be on the other side of the border. Some people, their farms straddle borders, so they can't go to the other part of their farm, or they can't get the vet over to look after their animals. So just so many crazy things happening around the borders, and it's really quite sad and not helpful. And then of course you get people that want to protest their civil liberties to not wear a mask, or to disobey all the public health things because that's their right. And here I've just got a random photo of Singapore recently, where it really is quite a pleasure living in a society where you just get on with it and work together, and you're one. So that's just a couple of examples on the importance of national unity. Global solidarity, you could well argue, why does that matter? So let's start with a few things, and let's do border closures between countries. So this is between Nigeria and Benin. This is Iran and Pakistan, and this one's Spain and Portugal. And you can see that really once you block it to people, you're going to get social and economic disruption to all concerned, and obviously economics of the two countries concerned. But there's obviously supply chain issues going to be here, and here is food in Africa that can't get across the border. PPE often can't get across borders, but most particularly so I'm talking about blocking it to people, but when you block it and actually have export restrictions, this is something I didn't really appreciate till recently, but let me just show you the next slide. And this is about export restrictions. And you can see, and you might wonder, why have I put Albania and Zimbabwe? And that's because almost every country has export. So this is A to Z. Almost every country has export restrictions, whether it's masks, bandages, medicines, surgical masks, medical gloves. Countries don't want to let the stuff that they might need cross a border. And again, this is presumably because they haven't stockpiled enough. But again, it's something that really is just not a good way to behave. We need to share all. Oh, sorry, and this is also going on with the various things. So this is Malaysia with their. This is Russia's all their various rules on what they can let out of the country. This is a UK one, stopping 80 medicines that could be used in intensive care from going out. Maybe they can go out, you just need permission. Here's an Australian one, export control on goods essential to controlling. So, and here's an updated version from the US, this Federal Emergency Management Authority that has updated it in August to say all the exports of things that we might need still have to stop. And this is probably why the trickle-down effect that hospitals across Singapore, the 3M95 masks are ending, they're out of stock. So if you live in Singapore, you'll be, if you need these masks, then you'll be going through a fit testing, and these are huge exercises across Singapore happening as we speak. So what else in terms of global solidarity? I think of employment and economics. The world is doing less work. Okay, there's about 10% less work. There's about 300 million full-time jobs probably lost. Countries are going to need a lot of financial support to simply avoid ruin. And then let's talk about the origins of the virus. Do we honestly think that anyone is going to confess up to being the source of the outbreak? Because once people start talking about compensation, do you think Malaysia is going to say, oh, we found the virus on our pangolins? Do you think other countries with bat samples are going to say, oh, look, the virus was over here, or the wastewater samples in Europe? No one is going to own up. So here's a clear example that if we don't work together, we've almost got no chance of understanding how this originated. So Jeremy mentioned, and indeed we discussed the ACT Accelerator a couple of, probably about 6 or 8 weeks ago. So this is just to remind you that it's ACT is the access to COVID tools, and there's vaccines, therapeutics, diagnostics. There's Jeremy's organization there in the middle of the therapeutics, and we know CEPI, the Coalition for Epidemic Preparedness Innovations, and Gavi, the Vaccine Alliance, diagnostics through the Foundation of Innovation, New Diagnostics with the Global Fund, and then the Health Systems Connector, which is trying to make sure that as these tools come, there's capacities within each country to deal with it. So what does that actually mean? By the end of 2021, we're talking about 2 billion doses. Anyone that's signed up to this is because there's about 8 billion people in the world, right? So any country that's part of this will get 20% of its enough vaccine for 20% of its population to be vaccinated. And that's an important 20% once you pick your most, the best way to spend it. There's also a commitment for the number of doses of therapeutics and also the diagnostics. So what's happened so far? There's 9 vaccine candidates. There's about 172 countries so far signed up to this, to the vaccine one. 80 are self-financing, 92 are low and middle income countries. And they represent about 70% of the world's population, okay? So I think it's very successful. When I say signed up, there's, at least verbally at this stage, the full commitment needs to come through on September 18 with some money. Therapeutics, the main one at the moment is dexamethasone. Diagnostics, there's 50 tests under evaluation, and 10 million tests have been procured, and the allocation is equitable. So let's just look at the alternative for vaccines. So you get things like this where countries can go unilaterally, or would you rather be something like this, which is so just to do that again, you've got countries going bilaterally. I think the US has got a couple. I think UK's got a couple. But these are the countries that at least offered to have their name there. There's actually more that haven't been that haven't declared their name as part of the vaccines pillar of the ACT Accelerator, which is COVAX. So why would you want to do that and not just go and buy your own? Well, you're part of a huge consortium, which has obviously got much better buying power. You're part of, so it's 9 so far, but not only will you have the chance to invest in a vaccine that works, but actually you'll have a choice, because just imagine if the first vaccine is 50% effective, so everyone jumps at it, but then 2 or 3 months later, there's one that's 80% effective, and you'll go, oh, we should have waited for the second one. So we need to be sensible about this. So I won't spend too much more time on that, other than to say this is the time where it seems almost obvious to work together in this. And interestingly, they've said that countries that go bilaterally won't be excluded from this process. So that's and I think that's the right way to go. You can't say you didn't sign up, we're not playing with you. So even if countries that don't want to do this, that they're allowed to later. Okay, that was my quick overview of global solidarity. I just thought this was cool. I saw this in Lancet during the week. You remember Richard Horton was on our show, and during the epidemiology updates, we talked about the Bangladesh numbers coming down because they were charging. So he jumped all over that and obviously did an investigation, and now it's become news. So I was quite pleased to see that the show's having an impact on what gets written, because this was clearly a mistake. Their prices have come down in Bangladesh since, but nonetheless, they still charge. Okay, I want to talk a bit about messaging, and this is going to culminate in the best song you've ever heard, or at least the best one about COVID. This are Uganda's, I mean, many people have done it, but these examples are Uganda. You can see, I've spoken before that messaging shouldn't just be from politicians and from people like me and David and Jeremy. It should be from people that can influence all walks of society. This is a reggae singer from Uganda called BB Cool, and you can see his song. It's called Keep Your Distance. You can see he's wearing gloves. He's at home. He's got hand rub, and the number for the coronavirus helpline is there throughout the song. There's also some cartoons on how to wash your hands and things like that. So fantastic. I think we really need to see more of this, especially when we hear more young people getting infected. Guess what? Maybe they don't want to hear from middle-aged professors. And the last one, which I'm going to ask to be played at the end of David's sign-off, is Bobby Wine and Nubian Lee. And this is, if this doesn't get you moving and putting a smile on your face, then nothing will. I always like to end these shows on a happy note, David, as you know. And I look forward, and watch the words of this. How's that? Sensitize the masses to sanitize. Over to you, David.
I'm happy, Dale. Thank you. It leaves me to thank Sir Jeremy Farrar for taking time from his busy workday to provide us his wisdom and share it with us. That was wonderful. Next week's speaker is Dr. Michael Ryan, who's Executive Director, World Health Organization Health Emergencies Program. The title of the discussion will be COVID-19 Pandemic, September 2020, The Way Forward. Look forward to that. Don't forget to register for the rest of the September episodes. There's 2 more. There's a chat box tool at the bottom of your screen. We want your feedback. It'll be open for another 10 minutes or so. We look forward to your comments. Until next week, stay safe, wear your mask, wash your hands, and stay informed. I hope you find comfort from our pandemic song this week, which was contributed by Michael Lim, Director of Communications and Development, National University Hospital, Singapore. It's not the song you'll hear when we close, which is called Coronavirus Alert by Bobby Wine and Nubian Lee. This contribution from Michael Lim is a 1945 post-World War II song, which embodies the sense of yearning for our former lives. The title is, It's Been a Long, Long Time. Enjoy and good night.
The bad news is that everyone is a potential victim, but the good news is that everyone is a potential solution. Sensitize the masses to sanitize, keep a social distance and quarantine.
coronavirus is sweeping over mankind.
Everybody must be alert. It's a global pandemic we can never take for granted.
Omulwadde wa corona temubuzanyisa bange.
Kila mutu must be alert. It's a matter of life we can never take for granted. Discipline and personal hygiene, and make sure you regularly wash your hands. Keep a distance from everyone. Report anything like a symptom. Serious fever is a symptom. Dry cough is a symptom. Walkway tamula is a symptom. Itchy eyes and flu is a symptom.
Obulwadde bwekuuma obutabusiiga lwejjemu batannalwala olaga omwoyo gw'eggwanga labira ku itale abasinga bafudde okuwewala kisingako obujjanjaba. The coronavirus is sweeping over mankind.
Everybody must be alert. It's a global pandemic we can never take for granted.
Omulwadde wa corona temubuzanyisa bange.
Kila mutu must be alert. It's a matter of life we can never take for granted.
Coronavirus is sweeping over mankind.
Everybody must be alert.